Hi, my name's Kathy McAdory. I'm a student at Auburn University in the nursing school, and I am in the graduate school for nurse educator. Today I'm going to be doing a head-to-toe assessment. For demonstration purposes today, I will only be examining one half of the body, so it will probably be the right side. And then also, before we started this video, I have already performed hand hygiene. I've already introduced to my patient, Leanne, and then I also have checked vital signs. I've gotten height and weight, and we've already done a Snell and eye exam, and the results were 20/20. So before I get started, the first thing I did is I watched as Leanne walked into the room, and I noted that her gait was, she was erect. She had no issues with her gait, and she was able to perform heel to toe and tiptoe, and then she also was tested for the drift test, and that was negative as well. As we get started now, I'm going to inspect, and I will be telling you what I'm doing. So first thing that I would do is I would be checking Leanne. I'm looking to check, how are you, Leanne? Good. I'm checking for how her face is shaped to be sure she's symmetrical. I note that she's able to speak with no slurs. I also note that hair is evenly distributed, and she has no lesions or any bruising at all. And at this time, what I'll do is I'll be palpating her scalp. I'll be touching you, okay? And I'm feeling around to be sure that there's no masses, no areas that are tender, any tenderness, okay? And as I look at that, the next thing that I'm gonna do is I'm gonna check out her eyes. And as I look at that, I see that her eyebrows are well spaced. Her eyes, I'm seeing her pupils are equal, reactive to light, and accommodating. As she talks to me, she's able to focus. And then I also notice that her eyelashes and there's no issues with the eyelashes, and then that her lateral duct is intact. But what I'm gonna do now is a complete eye exam with my ophthalmoscope. All right, I'm gonna be looking at your right eye, okay? And I'm gonna be getting close. Take my glasses off. Here, face. All right, and I'm able to see she's positive for the red light reflex. I also see that her optic nerve is visualized, and there is no narrowing of the vessels, no hemorrhages noted. The next thing that I'd like to do is I'm going to check out your nose, okay? And of course, I see right now her nose is midline, it's not deviated at all, and I'm going to be looking inside your nose for a second. All right, and I'm able to visualize the turbinates, and I'm able also to see that she does not have a deviated septum. All right, I'm going to put my finger on your nose. Can you blow one side? Awesome, and the other. All right, both nares are patent. The next thing that I'm be looking at is her lips. As I look at her lips, I see that they're moist and pink. Can you open your mouth for me? All right, can you stick your tongue out and say ah? Ah. All right, thank you. I see that her roof of her mouth is intact. Her buccal membranes are moist. She has wonderful dentation. And can you stick your tongue up in the air for me and let me see under? All right, and then I'm gonna look at your gums. All right, and that is pink and moist. No issues with that as well. The next thing that I'd like to check is her ears. First thing I'm going to do, tuck your hair behind. I'm sorry, my hands are cold. I'm going to look at your ear, and as I look at her ear, I see that there's no visible abnormalities and any tenderness as I touch. Nope. All right. Next thing that I'd like to do is look in her ear with my otoscope. Okay. Hold hands again. I apologize. All right, and as I look around, I see there's no foreign bodies, and her eardrum is intact. I'm able to visualize the cone of light, and I see that I'm able to visualize the malleus. Okay, my next thing that I'd like to look at is I'm going to be doing the Weber test. All right, so what I'm going to be doing is I'm placing this on top of your head, okay? What I want you to do is tell me when you no longer hear a vibration, okay? Yeah. Okay, wonderful. And then I'm going to be doing the Renee test. Okay, I'm going to put this on the back of your head, right here. Okay. Okay, and then again, And what she shows, first of all, is that her air conduction is greater than the bone conduction, which is a normal finding, and she was able to show that she has lateralization in both ears with the Weber test. Okay. What I'd like to do now is check some cranial nerves, okay? I'm going to start with cranial nerve 1. Could you please close your eyes? Okay. And could you tell me, what do you smell?
Orange.
All right, very good. Cranial nerve 1 is intact. All right, cranial nerve 2, what I'd like you to do is just look ahead at me, okay? I'm going to be checking your eyes. Okay, can you follow my pin light out? And then I'm going to bring this back in. All right, cranial nerve 2 is intact. Cranial nerve 3, be sure I've got these right. Cranial nerve 3, 4, and 6. She's going to actually follow and see what I do. All right, I want you to follow my pin light, okay? Up, over, side, down, and up. All right, 3, 4, and 6 are intact. The next thing that I would like for you to do, I did not do this with cranial nerve 2. We both are going to cover our eye. Okay, let's both cover our I'm going to cover mine, you're going to cover yours, okay? And what I want you to do is tell me when you see my finger, okay?
Okay. See it.
Okay, and
I see it.
okay, wonderful. So cranial nerve 2 is intact. All right, we're going to also be checking now cranial nerve 5. Can you do me a favor?
Mm-hmm.
I want you to grit your teeth for me. Okay, can you open and close your jaw? All right, cranial nerve 5 is intact. Cranial nerve 6, we checked earlier, so we're going to check cranial nerve 7. And this is going to be, I need you to raise your eyebrows. If you'll frown, smile, puff your cheeks out. Wonderful. Cranial nerve 7 is intact. Cranial nerve 8 is going to be, I'm going to cover your ear on this side. I'm going to be behind your back. I want you to tell me what I say, okay?
Chicken nuggets.
Awesome. All right, so cranial nerve 8 is intact. Cranial nerve 9 and 10. This would be, I'm not actually going to gag her, but I am going to check this again. I'm going to have her open her mouth and say, ah, stick her tongue out for me. Okay, stick that tongue out when you say. All right, wonderful. The back of her pharynx did open and her uvula is midline and raised appropriately. So that nerve is intact as well. Cranial nerve 10. That was 9 and 10. Cranial nerve 11. All right, so we're going to check. I'm going to put my hands on your shoulders and if you could please shrug up. All right, can you push against my hand this way? Push against my hand this way. All right, can you look up and down? Very good. Cranial nerve 11 is intact. And cranial nerve 12 is going to be sticking your tongue out. And if you go side to side, up and down. All right, cranial nerve 12 is intact. All cranial nerves are intact at this time. All right, what I'm going to check now is your tongue. Let me grab my stethoscope. All right. And the first thing that I'm going to do is I'm just inspecting your neck. I see that your trachea is midline. I see that I don't see any bulges, any irritations. I'm going to palpate your neck for just a moment, okay? Is there any tenderness, soreness? Okay, and what I'm going to do now is I'm actually going to palpate her carotid arteries one at a time. Wonderful. Cold hands again, all right? And then I'm going to auscultate with both my bell and my diaphragm. All right, and there are no bruits present. Next, I'm going to step along behind you, okay? And I'm going to ask you to swallow. I'm going to see if I can palpate your thyroid.
Okay.
Hands again. All right, can you give me a good swallow? All right, there is no tenderness, correct?
No.
Okay, no tenderness, and I am not able to palpate her thyroid, which is a normal finding. Okay, and what I'm going to do now is, while I'm back here, I'm going to listen to your lungs. Okay, first thing I would do, of course, she would not have on she would have her gown on. I would be able to visualize her back. I would be looking for any issues with symmetrical with her symmetry of her back. I also would look to see if there was any skin breakdown, ulcers, or lesions, and there's not. This would be a normal finding. And what I'll do first is I'm going to go ahead and palpate for tactile firmness, okay?
Okay.
Each time you feel my hands on your back, I would like you to say 99.
Okay.
Okay?
99, 99, 99, 99.
All right, wonderful. And it's very resonant, which is a normal finding. I'm going to go ahead and auscultate her breath sounds at this time. Each time you feel my stethoscope on your back, if you will please take a deep breath for me.
Okay.
One more time on each side. Okay, and for demonstration purposes, I will not be checking diaphragmatic excursion, but what I would do if that was being tested currently, I would palpate for lung resonance, excuse me, and then I would have her exhale, and then I would have her inhale. The distance between the two areas where I would measure would tell me her diaphragmatic excursion, and in this case, we will state that it is normal. What I'll do now is come around front, and I'm going to listen to your lungs again, okay? And same thing, I would check for symmetry, be sure there was nothing happening up front. I'm not going to check for tactile firmness up front, but of course we would do that again. And what I'm going to do now is listen to those lung sounds. Okay, same thing as before. When you feel this, if you'll just take a good deep breath for me. Wonderful. Alright, all lung fields are clear, which is a normal finding. Alright, what I'm going to do now is I'm going to inspect as we checked the chest earlier, and now I'm actually going to be checking. I would palpate the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral. And then of course where the area point of maximum intensity would be down at the mitral. So what I'll do, I would first of all, and I don't expect to feel anything. All right, and then get right through here. All right, and I'm not able to palpate anything, but I am going to auscultate now. S1, S2 is noted. I'm going to listen with my bell as well to ensure that there is no murmurs or any extra heart sounds. So a regular rhythm. And there's no murmurs heard as well. All right, the next thing that I would like to do is, I believe we're going to go ahead and I'm going to check for jugular vein distension. What I'm going to go ahead and have you do, if you'll lay down flat for me, okay? And it is an absolute normal finding. What I'm going to be doing is get you to turn your head that way. I'm going to lift the bed up. I'm going to be watching for at about 30 degrees. There it is. Normal finding to see both of those become visible. Okay. And while I have her right here, I'm going to go ahead and listen to her chest again, because sometimes we're able to auscultate some different sounds when a patient is laying flat. All right, so I'll be listening again, okay? What I would like to do now is I'm going to go ahead and examine her abdomen. I'm going to step to this side, and what I would be looking for, first of all, I want to be sure that her stomach is symmetric. And one thing that I can do as she's lying here, even though I'm not checking all the reflexes yet, I can go ahead and check the reflexes in the abdomen. And what I would do is I would stroke up above the umbilicus and down below the umbilicus, and I would expect to see some movement. I'm going to go ahead and auscultate before I palpate. All right, all four quadrants of the bowel are equally active. Bowel sounds are present, and there is no bruit detected in the aorta. What I'll do at this time now is I'm going to lightly palpate. Any tenderness as I do this, okay? And then, let's just take a good deep breath for me. Okay. And I'm able to palpate the border of her liver, and I'm unable to palpate her spleen, but both of those are normal findings. The last thing that I'd like for her to do is let's go ahead and sit up, okay? And we are going to, I'm going to palpate your lymph nodes. That's one thing I did not do, okay? I'm just going to hit a few of these, but these would be, first of all, would be occipital. Then I would be feeling for the preauricular, the postauricular. Any tenderness as I do this? Okay. And then there would be the parotid, the tonsillar, the submental, the submandible, and then the cervical. There's deep, superior, and then the subclavicular. Any tenderness with any of those? Okay. What I'll do now is I'm going to be checking your arms. Okay. I'm going to inspect first to see if there's anything. If her arms are symmetric, if what the skin color is, if there's any skin breakdown, hair distribution and such. All right, and then I'm going to go ahead and start off with your shoulder. Okay, I'm going to be palpating. Any pain with that?
No.
Okay, can you lift your arm up behind your head for me? Okay, and then to the side, and then down around. And can you put that in front of you? Wonderful. So she's got great range of motion. All right. And then as she did that, I actually also got to see that her elbow is also got fantastic range of motion. Is there any tenderness? Okay. And then with your hands, could you open, close, give me a good squeeze? All right. Fantastic. Her capillary refill is less than 2 seconds. And her range of motion and strength are both great here as well. What I'll do now is I'm going to check her pulses. Check the radial. I'm going to check the brachial. And for demonstration purposes today, I am not going to be checking the femoral, but in a normal exam, I would be doing that. And I'll check her lower extremities. You can relax. Check those lower extremities once I examine the legs. The last thing that I want to do for this upper body, for the arms, is I want to check these reflexes. The first one that I'm going to go ahead and check, let me see this hand, if you'll just relax. Okay, and I'm going to be getting your radial first. Okay, and that was a positive. And then I'm going to come up here to your brachial. I'll hold your arm right here, okay? All right, positive. And then I'm going to come check. There's a small reflex there, so that's normal as well. All right, next thing I'd like to do is I will be checking your legs, your hips, okay? So if you'll lay down for me one more time, okay? I lied, I need you to do it for me one more time. All right, and one thing that I want to do is, of course, before I palpate, I'm going to look, I'm going to be sure that her hips are symmetric, that I don't see any displacement. I see nothing with her knees or her feet, okay? So the first thing that I'd like you to do, if you could take your right hip, if you'll pull your knee up, and then can you cross it over to the other side? Wonderful. Any pain with that? Okay, and you can put that down. Of course, I would check the other side as well to be sure that she's got good range of motion. The next thing that I'll be checking is I saw also, we're gonna take your knee, if you'll bend your knee up, okay? And then can you rotate your ankle? All right, and then of course I would have her take her shoes off for this, and we would wiggle the toes, and I would check capillary refill at that time. All right, if you'll relax. All right, and then I'm just gonna feel for a popliteal pulse. All right, positive, 2+. I'm gonna check for her dorsal pedis and her tibial. And all of those are +2, okay? My last thing that I need to do, let me think for a moment. We've checked capillary refill, we've checked all those, we've done our reflexes. The other thing that I would check as well would be, I would have her, I would check a Babinski's, but since she's got her shoes on, I wouldn't. A negative Babinski's would be the normal finding for this. I think that will complete my head-to-toe assessment. Thank you.